please comment also, what is lung function tests or pulmonary function tests?
Well, when we evaluate somebody for asthma or for breathing difficulty, besides the history, which we talked about, besides the physical exam, which we're going to listen for things like wheezing and shortness of breath, then we do other things to try to evaluate how their breathing is. The lung function test, or the spirometry, is a very, very useful tool which should be done on everybody who has asthma that can do the test, because it's not an easy test to do. We basically take the patient and they blow into a machine, and it measures the amount of capacity that they have, how much air that they're really blowing out, and how fast they blow out. And through that, we can calculate the obstruction of the airways, how much they're closing down. And of course, when we give them medication like a bronchodilator, then they reverse and the airways opened up. So asthma is really a reversible airway obstruction. So you're asking me the definition of asthma. It is really a reversible airway obstruction related to inflammation and exposure to allergens.
What is the role of a chest x-ray in evaluating someone with asthma?
Well, a chest x-ray is really a tool that we use to evaluate the condition of the lung, and it just shows us a picture of what's happening in the lung. We don't get one on everybody who has asthma. We frequently, in pediatric asthma, when it's reversible and we can get a normal lung function, we may not get a chest x-ray. In an adult who has a persistent cough or a chronic cough condition, it's probably a useful tool to get a chest x-ray to make sure you're not missing something, that there might be something else going on. So basically, we use a chest x-ray as a tool to see if there's something besides asthma that's there, because asthma does not show up on a chest x-ray.
And what are the role of blood tests in asthma?
Well, we don't usually do very many blood tests in asthma. Since it's a respiratory condition, we're really more concerned about the lungs, the lung function. One of the new tools that we're using recently is called an exhaled nitric oxide. Now, exhaled nitric oxide is a new technology that measures the inflammation of the airway. So patients can blow into this device. We measure the amount of this exhaled nitric oxide and basically measure how much inflammation they have. So based on the level, we can tell whether or not the patient's in control. So one of the main things that we do as asthma specialists is to make sure that our patients' asthma is in control, which means their lungs are open, that they're breathing normally, and they don't have any lung problem or they don't have any breathing problem related to their asthma. So that's really our goal. So it's really control their asthma control, and that's our main purpose. So we don't really do blood tests. We may want to do allergy tests, skin tests, to find out what their trigger, what some of their triggers are. If they have a pet exposure, if they get worse during pollen seasons, we may want to do testing to find out, do they have an allergy to the pollen? Do they have an allergy to their pet? Things like that. So those are the kinds of tools that we really use to evaluate, the asthma function with a lung function, the inflammation, which is the exhaled nitric oxide, and then some of the triggers by doing allergy testing.